Presidential Steering Committee on COVID-19, distinguished ladies and gentlemen of the press. It's been a long while, and I believe that we've had a long holiday, but we are back to work now. I welcome you to the national briefing by the Presidential Steering Committee on COVID-19 for today, Monday, the 13th September 2021, after a very long time. The Presidential Steering Committee uses this opportunity to congratulate Dr. Chukwe Ihekazo, the Director General of the Nigerian Center for Disease Control, on his recent appointment as Assistant Director General, Health Emergency Intelligence of the WHO. While we recognize that this is an endorsement of his expertise and the quality of our national response, we feel a sense of joyful loss. We are, however, happy for him and wish him all the best, while we urge him to remain a worthy ambassador of our country, Nigeria. The global cases recorded continues to decline to about 4 million cases weekly, although it is less compared to last year, and the situation calls for caution because we are not out of the woods yet. Africa and Nigeria, in particular, continue to record rising cases and lots of fatalities. This can really be curtailed and reduced minimally if we adhere strictly to the non-pharmaceutical interventions put in place. I recognize the fact that the people are fatigued and tired, but let me encourage all Nigerians not to give up. We all need to come together to defeat this dreaded disease so we can return to our normal lives. Most potent way of getting out of this situation is through vaccines, which science and research has presented to us. I call on every eligible person to come out and be vaccinated. There are various choices now. We have the AstraZeneca, Moderna, Johnson & Johnson, and we expect the Pfizer biotech to be delivered very soon. There will be enough vaccines to go around soon. By the second quarter of 2022, we would have received about 52 million doses of the vaccines, sufficient enough for our people to be vaccinated. To ease travels for fully vaccinated Nigerians, we are exploring the principles of reciprocity between Nigeria and other nations. For the time being, Nigerians are advised to always carry their vaccination cards details or barcode on their electronic devices for easy access, especially for those traveling outside the country. Efforts are ongoing to implement the policy on vaccine mandate for all federal public servants. This is to ensure safety in the workplace and at home. The Executive Director, National Primary Healthcare Development Agency, will elaborate on this, as well as the status of vaccination administration in the country. The Ministries of Foreign Affairs and Aviation will continue to dialogue with the representatives of the UAE to resolve the issue of Emirate flights between Nigeria and the UAE. The protection of the interests of Nigerians remains our primary focus. The Honorable Minister would elaborate, Aviation would elaborate on this. Compliance with protocols laid down for quarantine to ensure control remains a source of worry to the Presidential Steering Committee. The need to review the protocol has become expedient to align with existing global protocols and realities. On this note, the Presidential Steering Committee would adopt a sustainable model and policy that will be unveiled very, very soon. To begin with, India has now been removed from the list of flagged countries in view of improved situation in that country. On the heels of Mr. President's intervention in the health sector, I want to use this opportunity to appeal to our health workers, particularly the National Association of Resident Doctors, to consider the health situation in our country and call off their strike while government continues to look into all matters that would improve the system, processes, and their welfare. Like Mr. President lightly observed, this is not the best of times for any strike action. I now call on the Honorable Minister of Health, followed by the DG, Nigerian Center for Disease Control, and thereafter the ED of the National Primary Healthcare Development Agency and the head of the Technical Secretariat to provide you with technical updates. Once more, thank you for your kind attention and have a very pleasant evening. Thank you.
Call on all Nigerians to accept testing and also accept vaccines. We have reports of new coronavirus mutations circulating in other countries, a development we shall be monitoring with all tools available to us to ensure that we respond appropriately. We also remain on alert at points of entry, including land and sea borders, to confront importation of COVID-19 across non-air borders. Several cases have been discovered, tested positive by rapid diagnostic tests, and they are taken care of accordingly. With regard to vaccines, all states have received doses of AstraZeneca, Moderna, Johnson & Johnson vaccines for the ongoing second phase of the vaccination exercise in all states. Federal government has done due diligence to ensure vaccine quality and safety. Available data shows that there have been no serious adverse effects so far following vaccination, and that so that confidence in vaccines that we are using should be upheld. The Executive Director of NPHCDA will give details of this. We have a good mix and good quantity of vaccines, and we do not envisage shortages, despite news reports that vaccines allocated to Africa will be reduced by 25% in the very near future. We believe the reduction may be linked with increased demand in high-income countries, many of whom have commenced third doses, booster doses of COVID-19, and also reduced their own country eligibility age to 12 years or even below. But all of this tells us that the vaccines are effective, they are safe, and that we should accept them without hesitation. The government of Nigeria has secured nearly 40 million doses of the Johnson & Johnson vaccines to be arriving in stages at a rate that NPHCDA will set to align with their utilization strategy. We shall also surely receive donor doses so that we will not expect to be impacted by the forecasted shortfall. I have no doubt that in the long run, we shall have to live with COVID-19, and so we must design a way to do so. The plan will vary, obviously, from country to country, depending on their situation, their strengths and their weaknesses, and also their resources. The search for and the pathway to such sustainability will need to be thoroughly interrogated from all angles and continuously reviewed to align with prevailing circumstances. There can be no one-size-fits-all, and countries will need to seek the best of both safety and socio-economic normalization. Last week, His Excellency the President received the leadership of Nigeria Medical Association in audience, and in his remarks called on doctors on strike to return to duty, and for those contemplating it to opt instead for peaceful resolution so as not to put the lives and health of citizens at risk. He reminded us that his administration has a sound track record of paying debts, even such debts as were inherited from or ignored by preceding administrations. Resident doctors are therefore assured from the highest authority in the land that all debts will be settled when they are verified and validated. With this, I want to call also on all striking doctors to put an end to that industrial action immediately and return to work. Nigeria has been lucky with the relatively low impact of COVID-19 so far, and we need to keep our preparedness optimal. We cannot afford to stretch our luck too far. And I also want to urge all citizens to avail themselves of the opportunity of the second phase of vaccine deployment and to get themselves vaccinated. I call on those who receive their first dose to go for the second dose when due and to optimize the protection we are going to get from vaccines. Thank you all for your listening attention.
Every night when we announce our numbers, it's very easy to forget that there are lives behind those numbers. And globally, every week till today, we lose 550,000 people worldwide to this virus. 50,000 people every single day. That's a lot of lives lost. These are not just numbers. There are people with families, children, communities, dreams, hopes, aspirations. As it is an important reminder of the work that we do and the importance of the work we have to keep doing. Yes, we do have some light at the end of the tunnel. It's easier to stand here and talk to you when we know that we have vaccines in Nigeria, and we have tools that we can now use to at least try and respond. It's been very difficult to do this without the tools at our hands. So right now, the challenge for all of us is to really come out and use those tools and make sure we afford ourselves access to those vaccines and protect our children, our families, our elderly, our vulnerable, our communities. This brings me to a very important topic today that I'm sure affects every one of us. Life during COVID has been very difficult for parents. And across the country today, this week, children are going back to school. Schools are reopening. School owners, principals are having to deal with a situation of taking responsibility for students, pupils, who might get infected, might spread the virus, and they have to take control. First, it's important to be aware that children are not immune to this disease, can get it as easily as anyone else, can spread it as easily as anyone else, even if they themselves don't get generally severely ill. But they are very good spreaders of the virus. The second challenge is when they do get ill, they don't present the way most adults present. They don't present very commonly with shortness of breath or with severe fever. They don't tell you they've lost the sense of smell or taste. They present with very unusual, normal symptoms that is very difficult to distinguish from a common cold, from what we call malaria, And if we as parents, teachers, caregivers don't take this seriously, they will go ahead and spread. And we've seen instances of large outbreaks in schools that have gone completely unnoticed. Till one person is found positive, then we start testing and we find out that a large population of that school is positive. Yes, even if they may not be severely ill, they are likely to present that virus to parents at home, teachers, guardians, all of whom may be a little bit more vulnerable than them. So in addition to the vaccines, we also now have rapid antigen tests that we can test the whole school community in a single day and give every student a result in 15 minutes. And we're ready to work with any school owner in any school in Nigeria that thinks for any reason they have a situation. Please get in touch with your state teams. We have provided them enough antigen-based rapid diagnostic test kits to test as many individuals as necessary to detect outbreaks and respond to them. This way we keep our schools going. Our schools have enough challenges staying open in Nigeria. In every part of Nigeria, there are difficult challenges to keep our schools open, but we cannot afford an uneducated future. We have to keep our children in school, and at least from our perspective, keeping them free from COVID is an important way of keeping them in school. Relating to other aspects of the response, they continue at pace. We continue to support many states. We have response teams in Akwa Ibom, Rivers, and Ekiti State right now supporting the states in responding to various issues. We continue to distribute commodities, rapid diagnostic test kits, IPC commodities across the country. Our risk communication teams continue to work to educate people. We continue to learn about the outbreak, publish what we've learned. There's a new paper describing the use of symptom scores to predict COVID-19 positivity in Nigeria that has just been published by colleagues. So across the spectrum of the response, we continue to work hard to make sure we respond, we learn from this, and we shape the response moving forward. Finally, the COVID-19 situation remains very different in various parts of the world. Some countries are experiencing steep increases. Some countries' hospitals are full. Others are seeing declines. This means that we must continue with our comprehensive response across the multiple sectors involved. We encourage all who have been vaccinated to follow the guidance of MPHCDA and to access all those who are yet to be vaccinated to follow guidance of MPHCDA and access the available vaccines that are safe and effective and are available across the country. When you do decide to receive your vaccine, please bear in mind that it must not lead to disregard for the public health measures that have been in place, because we still need them. We need all of them together. Please, as always, continue to take responsibility for your response, for our response. Take advantage of the increasing knowledge that we have on the tools that we have and how to use them. At NCDC, we continue to work very hard in collaboration with our partners to strengthen our response to the pandemic. Across the Federal Ministry of Health and the PSC, we acknowledge that this will be a long haul and that we have to adapt our response to that realization that this is not coming to an end in a hurry. So we're going to work towards defining a sustainable response, integrating the COVID response into the rest of our public health measures to make sure that we have the tools, the energy, the stamina to continue this response and make sure that as the virus doesn't get tired, we can't afford to either. So thank you very much.
Distinguished colleagues, members of the press, ladies and gentlemen, good evening once again. With your continued support in effective dissemination of information around COVID-19 vaccination, I am glad to inform you that as of 12th September 2021, a total of 4,052,756 eligible persons have received their first dose of the COVID-19 vaccine. This is made up of 2,645,020 persons with the first dose of AstraZeneca vaccine and 1,407,736 eligible persons with the first dose of the Moderna vaccine. A total of 1,692,315 eligible persons are now fully vaccinated, and we currently have a national average of 70.4% utilization of the 2,040,000 doses of Moderna, 2,040,000 doses of Moderna vaccines that we targeted to deliver to about 2 million people. As you are aware, we have reopened AstraZeneca administration as first dose to eligible persons 18 years and above who have not been vaccinated. I want to reiterate the need for those who have taken the first dose of the AstraZeneca vaccine to go ahead to the nearest designated health facility for their second doses. With the increasing number of cases globally, we are beginning to see countries institute vaccine mandates. Some countries have begun asking workers to either present a proof of vaccination or provide weekly COVID-19 PCR negative results in order to be allowed into public spaces. In order to end this pandemic, we must achieve enough level of population immunity that the virus essentially becomes a nuisance rather than a threat. The only way to achieve this is if eligible persons come out for vaccination and observe the non-pharmaceutical interventions. The COVID-19 vaccine remains the most effective tool against this virus. A recent study of the United States Center for Disease Control, USCDC, which examined about 600,000 COVID-19 cases, revealed that people who were unvaccinated were about 4.5 times more likely to contract COVID-19. It further showed that those who are not vaccinated against COVID-19 were 11 times more likely to die of the disease and 10 times more likely to be hospitalized with the disease. We should also be mindful of the long-term effects of COVID-19 infection, which is characterized by blood clotting disorders, lung and kidney problems. In this regard, let me emphasize that all COVID-19 vaccines are safe and capable of protecting people against the disease. We do not promote preference of one vaccine brand over the other, and we strongly discourage mixing of vaccine brands for the first and second doses without due guidance as provided by the Presidential Steering Committee. Considering the rapid progress seen in the utilization of Moderna vaccines, states have been guided not to exceed their 50% utilization rates for Moderna in order to reserve the second dose for those who have already been vaccinated. Most states have reached this percentage, and priority is now focusing on administering AstraZeneca vaccine as the first dose in all the states. We encourage states that are yet to publish their vaccination sites to do so across various media platforms, newspapers, radio, TV, and social media, to enable people locate their nearest vaccination sites. The list of vaccination sites across the country is also available on the MPHCDA website, www.mphcda.gov.ng. We have also published this in most newspapers. Eligible persons who are unable to register by themselves can go to any designated health facility where he or she will be assisted by our vaccination teams. In my last press briefing, I addressed the questions raised around the United Kingdom insisting on Nigerians who have been fully vaccinated to isolate upon arrival in the United Kingdom. As earlier mentioned, in Nigeria, we also require fully vaccinated UK citizens to isolate for 7 days despite being fully vaccinated. In diplomatic circles, this is often referred to as the principle of reciprocity. Nigeria, alongside countries like France and the Netherlands, are categorized as amber countries by the United Kingdom, based on criteria such as the number of populations immunized and incidence rates of the COVID-19 infection. Individuals from countries listed as amber countries are required by the UK government to take a COVID-19 test upon arrival and be quarantined for a few days. Regardless of a vaccine type or vaccination status, if a Nigerian with a Nigerian passport travels to a country on their green list and spends 14 days there before going to the UK, they will not be quarantined in the UK because they are coming from a green listed country. Likewise, if a German or Australian that is currently on their green list travels to a country like France, Ghana, or Italy, which is on the amber list like Nigeria, and such an individual spends 14 days or more in these countries before departing to the UK, such an individual will be made to do a COVID-19 test and quarantined, regardless of their vaccination status. Just like Nigeria, every country has its own COVID-19 travel rules, protocols, and guidelines for travelers coming from other countries. We've received multiple calls from flustered Nigerians about this issue. This is why we are reiterating the guidance provided by UK and other countries around the protocols. At this juncture, let me remind us that the federal government does not condone attempts by anyone to produce or procure or sell fake COVID-19 vaccination cards. Anyone who ventures into this will be apprehended and be made to face the law. This is a criminal offense in which both the buyer and seller will be prosecuted. We therefore urge all Nigerians to report any suspected attempt by any person or group of persons to sell or buy COVID-19 vaccination cards to us via our call center line on 0700-220-1122. That's 0700-220-1122. Any of our social media handles, Facebook, Instagram, or the nearest police station or any other law enforcement agency. No one needs to cut corners on COVID-19 vaccination. The vaccines are free, and the vaccination cards are given free of charge at any of our designated health facilities after being duly vaccinated. States have the responsibility to protect the vaccines and vaccination cards sent to them. They are to ensure that these vaccines are administered in a safe and effective manner and are made free for all. They need to hold their health workers accountable and sanction any health official who is found carrying out activities contrary to the mandates set by the federal government. Any state found to be condoning these acts of corruption will no longer be allocated vaccines that are provided free of charge. We have received reports of people trying to procure cards from health workers. These reports are being investigated, and anyone found wanting will be prosecuted. It is important to emphasize that it is in the interest of public safety and collective well-being of Nigerians that the federal government has made these vaccines free for all eligible persons. Let me further reiterate that the corporate vaccination for ministries, department agencies, public and private corporate organizations are to be provided free of charge. States and local government areas should please note that no fees or levies should be mandated from corporate bodies when teams are sent to provide these services. The government will continue to work with stakeholders and partners to ensure delivery of safe and efficacious COVID-19 vaccines in Nigeria. Finally, We want to call on everyone to take responsibility to protect themselves, their families, and communities against COVID-19 by going out to receive the vaccines and continuing to observe all measures to prevent further spread of the virus in the country. I thank you for listening.
It's been quite some time since we last have this press briefing, and therefore it is important to touch on some of the issues that have arisen in between. Number one, the state of the nation regarding the third wave of COVID-19. I have received questions from many of you. Yes, the third wave has continued, to escalate, but in the last few weeks we have seen it going down. We have talked so much about the Delta variant being most transmissible and most virulent, and many of you have asked, why are we not seeing the cases the way we have seen in the second wave, and why are we not seeing mortality as high as we have seen? We do not have exact answers to these questions, but I will tell you some of the modest efforts that have been put in place may be responsible for the slowing down of this third wave of COVID-19. If you look at it several weeks after the third wave, it is still not as high as the number of cases were recorded during the second wave. We will not say it is yet over, but we know that these modest efforts have helped to reduce the spread of COVID-19 in the country. The pattern of our epidemic highly coincides with the importation of cases, with travel surge in the country. It is mostly when schools have closed, we have our children coming back from various parts of the world. When summer vacations are over, people are returning to Nigeria, or during Christmas and New Year holidays, when people are coming in or going out of the country, they have consistently coincided, based on the ecological data, with the period of the peaks of our epidemic. For this particular third wave, you are aware of the intensity of restrictions that have been placed at our airports. We know that is causing a lot of inconvenience, and we know it may not be as efficient as we want it to be, but it has helped to reduce the number of people who come into the country and go directly into contact with their communities to spread this infection. People who get vaccinated, particularly Nigerians who are returning back, have also asked us regarding waiver for quarantine or self-isolation. Number one, we know, and you can also tell us, that self-isolation at home doesn't work. It has not worked. People do not comply. And therefore, our modest effort at identifying countries that are highly put us at risk, to restrict passengers coming from those countries into quarantine facilities, at least for the period when they will be infection-free, has really helped. Nigerians who are returning who are vaccinated. So first, let me just talk about the concept of herd immunity. The concept of herd immunity is such that a great proportion of your population have been vaccinated, and therefore, when you introduce an infection into that community, it doesn't make sense because the person will get into contact. The chances are that every person you get into contact with is already vaccinated, and therefore that person will not fall sick or will not be hospitalized or will not even die from it. But the reverse is the case in our case. Our country is largely unvaccinated. Our vaccination level stands at just a little above 1%. Now that means we are largely unmitigated community. And people who are vaccinated actually are not protected against being infected or transmitting the infection to other people. So when you are vaccinated, you've gone outside, you've gone to a high-risk country, you are likely to get the infection. But when you come into the country, because we are unmitigated population, you are likely to transmit the infection. And if you do that, because our population is not vaccinated, people are likely to fall sick, or they are likely to be hospitalized or to die. So I said this so that we can understand because of the questions that I have received from many of you. Our travel protocol has been modified to include some of the actions regarding diplomat. And that has caused some difficulty in the system. As such, some passengers experienced some difficulty in the last few days while trying to log on to the NITP. Perhaps that was the reason why we had an emergency meeting and we downplayed that restriction. And we asked every Nigerian or every passenger coming to the country, as long as he has a negative PCR result, can board a flight and come to Nigeria. We hope to fix this problem within the next 48 hours and we'll go back to our earlier protocol. In the last few weeks, we've also worked very hard on developing an alert system for easing restriction. This will soon be ratified by the Presidential Steering Committee and will be the guidance for us as how we rate our states. Which state is high on level 4, which state is on level 3, which one on level 1, and based on this, there are recommendations regarding the type of restrictions that will be implemented. Relating to this is also our effort at working with the state government to ensure that we build up our compliance system such that public places and Nigerians are protected. You will recall that we have identified high priority states, about 8 of them. Now we have seen other states in the southwest and south-south also catching up with the high numbers. But we are starting with 5 states where we have mobilized a team of the security, logistics, and mass care pillar. This includes the police, the army, the civil defense, and other security forces in the country to work with these state governments to define sustainable pathways to implementing a framework for enforcing compliance in the states. It is only by this measure that we will ensure that people actually do the NPIs and they comply with our public health containment measures. The aim is not punitive, but to reduce the rate of transmission in our community. As the DG and CDC mentioned, the schools are opening. People do not want to be restricted in our markets, in our workspaces, in our motor parks. But it is important, if we don't want that to happen, that we actually comply and make sure that we keep the distances and we mask up at all times. Political activities are going to start, or they have started already. Elections are going to come up. And we are working with the relevant agencies, INEC and its political parties, and also the governments of the states, to ensure that we follow these necessary guidelines while we conduct our activities. You've also talked a lot about the choice of vaccination. You only talk of choice when you have a lot of options. What we have in this country, the number of vaccines we have, is actually too small to say that we have choices to make. People should come out and embrace the vaccination program and make sure that themselves and their loved ones get vaccinated. Getting vaccinated is almost equivalent to a guarantee that you will not be hospitalized if you get COVID infection or if your loved ones get COVID infection. We have seen data from other countries where even though their vaccination level is high, yet the rate of infection has also risen to very high levels. However, what is important is that in all these countries, the rates of hospitalization have remained quite stable, or if they rise, they only rise by a very small proportion. So thank you very much for listening, and thank you for all the work that you are doing.
Thank you.
Mr. Chairman, distinguished members of the committee, and my friends, gentlemen of the media, good afternoon. I will speak a little longer than I intended for two reasons. Reason number one is that we have not been briefing for a very long time now. And number two, because on top of all of the good work you've been doing to escalate and to report the activities of this committee, somehow quite a number of people do miss the news. And when they miss the news, they assume that there is no news. And because the subject matter of Emirates have become topical, perhaps it's expedient for me to give a brief history of where we've been through, but really quickly, within a few minutes. So like every other country, UAE established protocols when you travel into their country. You remembered on this platform, we've argued and discussed some of the positions that they took at that time, which we found very discriminatory and targeted at Nigeria, and it was country-specific, and we said that it's not acceptable. And we were mandated to dialogue with them in the interest of both parties. So some of the problems at the time were that scientifically it's been proven that this virus, once, may God forbid, you catch it, it takes 4 days to incubate, to show in your body when you're tested, to show whether you are negative or positive. And they required that we make a test 48 hours before departure, and then show negative, then come to the airport and do an antigen test. Now they changed it to a PCR test, to also show negative, to also fly 7 hours later and land in Dubai and do another PCR test, and get to the hotel or accommodation and do another test. All of this will be happening within those 4 days. So obviously they will be showing negative, 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 so long as the test was genuine, because it will still be within the incubation period. We thought it's unscientific. We resisted, and at that time it was only specific to our country. So because of the hardship that people are going through, because of all of this work permit, all of this hospital, all of these students, all of these petty traders and businesses, and so on and so forth, and even people going for leisure, we believe that we should change our position to accept those tests, because after all, it's their own protocol. We have our own in Nigeria, make a PCR test 48 hours before, come to the country, Nigeria, and repeat the test day 8 after the first one, because it is 4 to 14 days incubation period. So we accepted the test, all of the various tests that they will be doing. And as a matter of fact, we'll expect further more tests if they want to. But they bounce back to us with a policy, with a rule that we must fly Emirates into UAE. If you dare fly, say, Ethiopian Airlines, or Qatar, or Turkish, or British Airways, you must spend 14 days in that country that you're transiting through to go to UAE. Not minding the fact that whether you have a visa in that country to stay for 14 days, or you even have the money to remain in that country for 14 days. And most of the people traveling are really low-income earners, petty traders, whose total capital is not more than 2 million naira. So we thought this is a bad policy, and we thought this is targeted at our country, and we thought it's not acceptable for the obvious reasons that we do not have to have the visas, we don't have to have the money, or we don't have them. So we pleaded with them to reverse that rule, or to remove that 14-day rule. And that's where we are. We've been going on, and there have been lots of arm twisting and so on. But Nigeria is not a colony. So we've gone through Ministry of Foreign Affairs. Now we've been mandated by the task force, jointly with the Foreign Affairs, to resolve this impasse. It will be resolved. We're very sure it will be resolved, but it should be resolved in a fair manner to our teeming passengers. We do note also that people go through Ghana to travel to UAE or through Cotonou. We had so. That makes the case even worse, which means it is targeted to Nigeria. If a Nigerian can go out through Ghana and travel to UAE and he's fine, then it is targeted at our country, Nigeria. And that's why I think to make the statement that we are not a colony indeed. So the request is a very simple one. To allow us, if they want, we will accept to do 1,000 tests. Anybody who wants to go to UAE for good reason can go through 1,000 tests, no problem. They can poke your nose 1,000 times because you want to go to UAE. And it's their requirement as a country. They're also not a colony. But it cannot be something that we'll accept on behalf of the Nigerian people that is against the Nigerian people. As policy makers, we don't do policy for a certain category of people. It is for the have and the have-nots, the elite and the downtrodden. It is for everybody. We go through the pain, yes. We're at an unusual time, yes. But unusual time demands unusual solutions and unusual consideration to the plight of the 200 million people in our country. So the good news is we will continue the dialogue. They wrote us letters upon letters upon letters. One of the letters they wrote was from a Dubai Civil Aviation Authority, requesting us to please grant Emirates the flight and saying that they have allowed or removed the rules for those that have their doctors in UAE they want to go back to, or their schools they want to go back to. That's only for those who are on medical condition that they have been there before, and also regarding those going back to school. So for starters, the bilateral air service agreement between the two countries is between UAE and Nigeria. And the Nigerian Civil Aviation Authority counterpart is the UAE Civil Aviation Authority, not Dubai. That said, if we will be receiving from any legal entity the statement to the effect that they have removed the 2 weeks rule, we are good to go. And it should be copied us and directed through the Ministry of Foreign Affairs, through the protocols. So please, gentlemen of the media, do the needful like you've been doing. To carry on the news, couple more. It isn't Task Force COVID-19. It's also not Civil Aviation Ministry. It's neither also the Foreign Affairs. It is us collectively resolving something that we believe will be good for the nation. Thank you very much.
Thank you very much for clearing the air on those issues. Well, we now want to take some of your questions. Are we ready? All right. Reuters.
It's very easy to put blame onto a person. But if it were to be me, there wouldn't have been the task force. There wouldn't be a steering committee in place. Everything that I do, I don't do it as Hadi Sirika. I do it as Minister of Aviation for the Federal Republic of 200 million people. So there's nothing like that. In fact, perhaps Emirates is my second most preferred airline in the world. I'm a loyal member. I've been flying the highest status of gold since Emirates was created until tomorrow. So, and most of the activity that we do in civil aviation will have to, or will cause us to pass through one way or another Dubai. Even when going to Canada for ICAO meetings, I find myself going east before I go west. So the story is as told before. The story is they have a protocol that discriminates against Nigeria, and it was specifically targeted at Nigeria. And we said no. And it's on behalf of the people, like I said. Secondly, when we passed that hurdle, another hurdle of the 2-week rules, or 2-week rule, was put on us that we must, if we go through, dare go through. For example, if you are a traveler and you go in as a petit trader to Dubai or to India or anywhere, and you want to go via Ethiopian Airlines because you find it's either cheaper or more convenient, or whatever reason you have, as a free market, the rule is saying that you will stay in Addis Ababa for 2 weeks before you proceed and enter Dubai. And this doesn't make sense, because you will be needing visa to stay for 2 weeks in that country. You also be needing money to spend in that country. So it doesn't make sense. It's a non-starter. So this is the position, and in the wisdom of the PSC, the chairman has just announced that they have mandated us and Foreign Affairs to resolve it. And I'm sure they would want to resolve this, because Nigeria is one of the biggest markets that they have. I think if you take out London, New York, Joburg, and Beijing, I think Nigerian route is the highest in frequency, but also the most lucrative in the world for any airline. Nigerian routes are the most lucrative for any airline, British Airways. I was just reported yesterday that British Airways is charging £5,000 for economy ticket. And when you lose a day, you go the next day, it becomes £7,000 for economy ticket to Nigeria. So the benefits to them is monumental. And we will continue to be loyal to them, but they must pay loyalty back by recognizing what Nigerians do. We are good people, we buy their houses, we go to school there, we go to hospital, we go to enjoy ourselves, and so on and so forth. And so this is the situation. And I believe that it will be resolved very soon. Thank you very much.
Thank you very much, Honorable Minister. It's very clear.
Before I go on to that, I would like to say a bit about the Delta variant. If there's anything that is still mysterious about the entire COVID-19 is the behavior of the virus. It is still being studied, still being examined, and there are many surprises that come up now and then. So why does the virus mutate? Yes, viruses do mutate. And what determines it? We don't know. This particular variant appeared first in India, was at first called the Indian type, the Indian variant. But over the years, it has gone around the whole world, not only Nigeria. Within a short time, when it entered the UK, they did announce that most of all their, and eventually all the viruses they had were of the Delta variant. Now, in Nigeria, for quite a while, we didn't see it. We are quite correct that by the 2nd of August, we were seeing just, I think, 4 states or 4 that were reported. NCDC will talk more about that, but we have had the same experience as other countries had. That before you know what's happening, this Delta variant took over the entire scene and almost suppressed all the others. So the experts in virology or infectious disease will be able to give more details. Now, the question of the PTF, the impact. The PTF is what you would call a special purpose vehicle. Special purpose vehicle created by His Excellency the President in his wisdom to have a broad whole of government response to the COVID-19 threat. When this infection first came, it looked entirely like a health issue. And at the Ministry of Health, yes, we did the needful. We were working at that time with Port Health, NCDC, particularly a lot with the government of Lagos State, because they had the majority of the cases at that time. We also worked with the medical research, Nigeria Institute of Medical Research. But it began to manifest that the response to COVID-19 is beyond the Ministry of Health. It has something to do with travel. It has to be taken from one place to the other. So that brings in the aviation. It has to do with those who grant permission to travel, immigration, internal affairs. It has to deal also with foreign affairs because it deals with a relationship among countries. So bringing together so many agencies and ministries who had to work together is what many countries did, and then named a senior official to lead it. In the UK, you see that most of the briefing is done by the Prime Minister himself. In the United States, at the beginning, you see that the president there at the time, President Trump, was the one doing his briefing by himself. Others nominate somebody else in a senior category, and the president, in his wisdom, nominated the Secretary of the Government of Federation to handle this umbrella special purpose vehicle, and it has had a very good impact in many ways relieving the Ministry of Health of a lot of burden that would have to be followed up at the same time, and bringing in the wisdom and knowledge and experiences from other ministries to come together to find answers to a solution. You can see the example now of the subject matter of the Emirates flights. It involves health, it involves aviation, it involves Ministry of Foreign Affairs, because it revolves around testing, which is health issue, and then the rights of the citizen, and then the flights that are involved, which is foreign affairs. I mean, the flights are aviation, and then the dealing with the government, which is foreign affairs. So you see a classical example there of all those who are stakeholders, let us say, stakeholders or participants in one subject matter. And of course, it's difficult to iron out certain things, and the Secretary to the Government of Federation has told the Ministry of Aviation and Minister of Foreign Affairs to tackle it, come together, tackle it, and let the rest of us know what recommendation they have. So to answer your question, it has been very impactful, and it has coordinated the entire response, whole of government response to the COVID-19 threat.
Deaths. So the monitoring of deaths is a little bit more tricky than monitoring cases, because deaths occur at periods of time after the diagnosis. So what has happened is, as we improve our surveillance, we push the treatment centers, and sometimes people die at home, to send us the data. So we got a backlog of death data, which we then had to backwardly integrate into the existing surveillance system. That's why it seemed like there were a lot of cases of deaths in the last few weeks. But those have all been adjusted. Our cumulative case fatality ratio still remains below 1.5% generally. There was a question on the UK's policy on PCR, on entry. We are constantly evaluating our policy, but our policy is not driven by what other countries are doing. We consider what other countries are doing, but then we take decisions here that are aligned to our own reality, our own needs, and those things are under consideration at the moment, and we will announce any changes of policy as we proceed. Today, we've already announced that India is coming out of the countries for which the extra restrictions in place, announced by the chair. Rachel, you made a few comments, thank you very much, and to other colleagues relating To the appointment, I think we all recognize that this is really in recognition of the response Nigeria has had and delivered as a country. And so it really puts an onus on us to continue pushing very hard in that direction. You asked about the use of artificial intelligence. I think this role will include the use of all intelligence tools to gather information to make sure our leaders are well informed around the decisions that they have to make using both traditional and non-traditional means. And I think your final question really was around the funding for epidemic preparedness. I think the federal government has really supported the response through the Presidential Task Force and then the Presidential Steering Committee. So we're very grateful. And that support is what has enabled us to sustain the response up till a few weeks ago. We just completed another nationwide distribution of commodities, additives across the country. We haven't heard of any stockouts, so the response has been ongoing. All of this has been supported through the Presidential Steering Committee, initially Task Force, but now Steering Committee. But also the Honorable Minister of Health has worked very hard to ensure that health security is now part and parcel of key health sector financing mechanisms moving forward. And we're very grateful for that. And that means that we're able to build on the successes that we've had collectively. All of these laboratories around the country, treatment centers, they all need to be sustained. They will not survive on their own. So this financing going into health security really recognizes that this threat will remain with us for a long time. And the investment is in preparedness. It's not actually in response. If we get our preparedness right, then the investment and cost of the response will be minimal. And that is really our strategic approach moving forward, to sustain the gains of the response. So thank you very much.
First question was from Amaka. If there is a way specific cases can be looked into in terms of vaccine preference, what we have provided is a broad-based guidance that the vaccines work effectively in all cases. But if there are specific reasons, for example, if an individual has a predisposition to clotting, then that conversation has to happen between that individual and his health provider. And I'm sure that they will reach a decision based on the different properties of the vaccine, on which is the vaccine that is most compatible for that specific clinical condition. And then Rachel asked about the 10% of the population target. Now, the 10%, the regional World Health Organization has a target of 10% of all populations in countries to be vaccinated by the end of September. As we all know, that is a broad-based aspirational target. The contexts of each country will come to bear, especially when you begin to look at the shortages in global vaccine supply, right? Of course, if the vaccines are available, then countries can target those types of numbers. But with the vaccines not being available, then it's kind of hard for you to reach those targets. We also have to recognize the context within which WHO made that target. It is to encourage developing countries that are hoarding vaccines to release these vaccines so that African countries can also have access to these vaccines in the spirit of equity and fairness. So we continue to engage globally with this government through the different platforms to see how more vaccines can be made available to low and middle income countries, especially when you look at some countries going below 16 years to vaccinate, and then they're talking about booster doses, third and fourth doses of the vaccine, when it's still a challenge for many countries in Africa to get even the first dose. Then you asked about the expiry date, whether we're going to be able to ensure that vaccines don't expire before their expiry, whether we'll be able to utilize the vaccines before their expiry date. The answer to that question is an affirmative yes. From our analysis, we review the data on a daily basis to see how we are absorbing these vaccines in relation to the expiry date. We had similar challenges during the first phase of the vaccination when there were concerns about whether we'll be able to finish using the vaccines, especially where countries such as the DRC and Sudan were actually destroying their vaccines. That is not likely to happen in Nigeria because we're working with data and we're engaging with the subnational level to ensure that the vaccines are deployed to where they are needed the most. So in some states where the absorptive capacity is very high, that is where we send the vaccines that have the closer expiration dates. So it's a question of, first in, first out, right? If the expiry date is closer, those are the ones that we will utilize first. And then the question from NTA, I think the chairman made it clear that there's no circular about mandating vaccinations. And then with respect to me giving additional information about what we're doing around vaccinations and federal public servants, those are conversations that are still going on. It's very important for us to understand the backdrop for these conversations. So for people who have refused to take the vaccine, they stand the risk of infecting people who are very vulnerable. There are people, for example, that are immunocompromised that live and work with us. Those people may have been advised by their health providers not to take the vaccine, right? If somebody refuses to take the vaccine and they are infected and they now go ahead and infect these individuals, right? The conversation as a society is whether that is fair, right? Whether it is fair that we have given all information necessary to assure people that the vaccine is safe and effective, right? Given all the reasonable data that is available to assure Nigerians that the vaccines are safe. And some individuals refuse to take the vaccines. At this point, there is no conversation about making vaccines mandatory. The conversations that are going on is that if you do not want to take the vaccines, then you will have to provide proof of PCR testing. It could be every 72 hours or every week. In some countries, what they have done is to say every week. So it's a choice that you can make to either get vaccinated or be prepared to provide evidence that you are not carrying the infection so that we protect the vulnerable in our societies, the elderly, the sick, the immunocompromised. This really is the function of government to protect everybody, especially those who are vulnerable. And these are the conversations that are going on around the Presidential Steering Committee so that not only are we protecting people, but we also make sure that if there's any such guidelines or standards from the Presidential Steering Committee, that it is done in an environment where there's equity in terms of availability of vaccines. So there will be no guidelines mandating anybody to take vaccines. We have to be sure that those vaccines are equitably available so that you don't say, oh, you have to do a PCR test when the PCR tests are not available, or take the vaccine if the vaccines are not available. So all of this have to be done in close consultation with the subnational level. Conversations are also going on with the Nigeria Governors Forum so that there's harmony in terms of whatever guidance we provide from the Presidential Steering Committee. Thank you very much.
What I would like to mention is that right now, WHO is monitoring data shared by different countries and member states on the outcome of infection in various settings. And we are aware that some countries are already reporting a higher death rate or severity of disease in a patient infected with Delta variant compared to other variants. But at this stage, we do not have a irrefutable account of those cases. We continue to monitor the data, and once we can be sure that that's happening, we should be able to update our recommendation. But right now, there is no indication that being infected by Delta variant lead to a higher risk of hospitalization and death. Having said that, we know that Delta variant is twice as transmissible as the other variant. So with that, we can expect more hospitalization. And we also know that the Delta variant is coming with a higher viral load. So it can explain some of this funding some countries are seeing. But, you know, scientific inquiry is made of falsification, verification. So right now, we do not have evidence that that's the case. But we'll continue to monitor the situation and update. Now, the rationale between the rationale for establishing that hub for epidemic preparedness intelligence, it's also one of the recommendations, actually, of the independent panel on pandemic preparedness and response. You will recall that one of the shortcomings of this response to the COVID-19 pandemic was a delay response between the time the pandemic started and the time the world started responding. It was perceived that the world started responding a bit late. And one of the reasons why the world started responding a bit late, it was also somehow linked to the provision of the international health regulation, which in some way rely on voluntary reporting of the country, or kind of authorization before WHO could report cases outside that territory. But with the hub, using technology, it should be possible to detect information earlier and inform the response earlier. Of course, it's an undertaking that will require collaboration for the whole world, which is really one of the benefits we will gain from this, the establishment of this hub. Thank you.
Okay.
Relaxation on QR code. Why did we do it? Now, and whether we did it for restricted countries. So why we did that is because there is a glitch in the system. When you are completing the travel portal, you get to a point, and then either your data get erased or you're not able to complete to reach up to payment. It is not for most of the passengers. It is just for a few. We were worried that some people were missing their flights and some people had to reschedule or had to pay again. It is very few isolated cases, but despite that, we don't want it to continue because it actually includes a group of people, including children. So that is why we issued that waiver. What that waiver means is that you will do all the things you are required to do. First of all, you need to have a PCR test from your destination country, which is not older than 72 hours before departure. You get to the airport. If you're able to complete the NITP and not able to make payment, you can print your health questionnaire and print, the barcode without payment, and you'll be allowed to board. But our standing instruction to all the airlines is that people must provide a paid QR code. So that really disenfranchised a few of the passengers. And that is why we have to allow this, to ease this restriction so that people can board, because it is really of no problem of theirs. An additional point I would like to bring to your attention is that about a couple of weeks ago, we published a list of defaulters, about 1,200. And I know most of you have propagated that news, but that needs to be coming on so that we will sensitize Nigerians that if you don't comply, there is certainly going to be a penalty. In addition to what the chairman mentioned regarding removal of India from the restriction, we've also allowed issuance of STR visas in the restricted countries. This will allow them to travel to a third country to stay for 14 days before coming to Nigeria, because what immigration did was they actually closed issuance of that visa. So with these two processes now, we have seen a lot of ease in terms of allowing people to conduct legitimate business and to travel, but certainly we have to make sure that when you travel, you do so safely. Thank you.
Thank you, Dr. Mukhtar. Well, ESE for his closing remarks.
Honorable Ministers, members of the PSC, distinguished ladies and gentlemen, I will make a closing, a very short one for that matter, but I just wanted to also lend my voice with regards to the issue of vaccine mandate. We are not the first to start. Even in this country, there are 2 states that have already imposed that. They don't even have access to vaccines, but they have made a very categorical statement that they would insist. This is the matter. For us to get to herd immunity, we need to vaccinate at least 111 million people. That's about 70% of our population. 111 million plus people to be able to say comfortably we have a good coverage of our population. You've had Dr. Faisal give you the statistics that so far total eligible population so far vaccinated with the first dose is just slightly over 4 million. And with the second dose, just 1.6 million. If we go at this speed, you can trust that we've got a long way to go before we are able to ramp up our vaccination to get us to where we would want to be. And he did, in his comments, spoke about the drive and the special arrangement to get groups made up of eligible staff, families, and dependents of federal ministries, departments, and agencies, private organizations, corporate entities, and their retirees, etc., to get vaccinated. What we are trying to do is to create a safe working environment for people, and to also prepare our officers so that they are not inhibited in any way in performing their duties. Let me give you a typical example. The United Nations General Assembly, which is the biggest meeting of the countries of the world, will be starting next week in New York. Assuming that the American government says that unless you are vaccinated, you won't come. Do you know the number of strategic officers that ought to be there to prepare grounds for side meetings, for participation in different meetings and programs that would not be able to go? Just for the purposes of example, if such a thing should happen, a lot of the officers in government might not be able to attend. So we are not only looking at the individuals, we are also looking at the efficiency and the expectations that government functionaries and the roles that they have to play, not only in Nigeria, but outside the shores of this country. And whether we want to believe it or not, very soon, vaccine mandate will become global. I mean, for some of us that were born in the 50s and the 60s and the 70s, until probably recently, you couldn't get into the UK without the yellow fever card. That's a vaccine mandate. So if you want to travel to the UK and several other countries. I can tell you for free that even today, there are about 3 African countries. If you are traveling from Nigeria, you must show evidence of that yellow card. Tanzania is one. I was there in 2019. As even the secretary to the government of the Federation, there was a demand that I produce my yellow card. Kenya is another one, and South Africa. There could be many more on the continent of Africa. Even after Nigeria has been exited from the list of countries that do not have yellow fever as an epidemic. Some countries are still demanding that if you are coming into their country, you must produce an evidence of the fact that you have taken this particular vaccination. If not, you know how much it costs there? It's $200. You will be given the jab right at the airport and you will pay $200. So very soon you will not be able to travel anywhere. So for those of you, Nigerians are highly mobile. We travel. That's what we do for fun. As a matter of fact, most times Nigerians don't travel. We travel just for the sake of traveling, because we love traveling. Others, out of necessity, is either they are going for medical treatment, or they are going to school, or they are going for their businesses. But generally, Nigerians like to travel. So we are helping Nigerians to prepare them for what will eventually come. I can bet you by the time that optimally, you heard Faisal say that there has been a reduction, or Faisal or the minister, in the supply of vaccines. Why? Because the people that are producing the vaccine want to give their people a booster dose. They want to give their people a booster dose. So that is even affecting the supply that should come to you, so that you can speedily be able to meet a certain proportion of your population to be vaccinated. So we are not going to be very drastic in the implementation of vaccine mandate, but we are preparing particularly personnel of the federal public service. That yes, we need to prepare you because you have assignment for the government. And we also want to create a very safe working environment. Because from statistics and from science and data, most of the fatalities we are getting today are people that are not vaccinated. People that are not vaccinated. So you see, the thing about the COVID-19, what it has been able to do, and one of the reasons why our response have been adjudged with some measure of success is because we've been very blunt. You don't protect yourself, the chances are that you will get infected, and the eventual consequences could be mortality. And we want to avoid that. And that's why we are making that available to all of our people. But like I said, it's not a thing that will be imposed in the next 1 week, 2 weeks, 3 weeks. We must make sure that there's an equitable supply of the vaccines before we will be able to start in stages as to the number of mandates and how it is going to apply. But like I said, in the same vein, when vaccines were made available, the first priority went to frontline workers. The health workers were the first we vaccinated. And we're still pursuing that, because if they are safe and protected, they will be able to give care to those that will come into their facilities infected. I want to say that in spite of every shortcoming, our response would continue to be as aggressive as it were when we were a presidential task force. We know that we've divulged a lot of the responsibilities to the MDS now, but the Presidential Steering Committee continues to keep its eye on the overall policy formulation so that we do not lose the benefits and the gains that were attained when we were bootstrapped on the ground as a presidential task force. And I will say it without any fear of contradiction that the team that the president assembled as a presidential task force, for all intents and purposes, have worked assiduously and seriously to ensure that we got to where we are today. So I'm not surprised that even the world is acknowledging those modest efforts through the appointment of Dr. Chikwe. And also even Dr. Sani has been asked to represent Nigeria on an advisory council that is chaired by the President of South Africa. So two men who served very diligently along with our other colleagues on the presidential task force. Their intellect, their abilities have been recognized by the world. And that is the Nigeria of the future. And that is my hope for each and every one of us, that in spite of our shortcomings as a people, in spite of the difficulties and the hazards of the environment, we as a people can still excel in what we have resolved to do with every form of determination. So, I mean, the example of these two gentlemen and the acknowledgement by the world that we have put up a very robust national response should be the picture of the future of our country. Thank you and good evening.
We want to thank you, our chairman, for that persuasive communication. I want to thank my colleagues very sincerely for having such a waiting attitude, for being with us. When next we are going to meet, you'll see it on our platform. Thank you and good night.